morning, good afternoon, good evening. Welcome to our podcast, Sheila Speaks, a podcast, and I really do mean it's designed to educate, empower, uplift, and impact your life, your living, and really deal with quality of life issues and or conversations. Today, we are beyond fortunate to have with us Dr. Monet Bowling. Oh my God. She is a breast cancer surgeon at the Hendricks Regional Health Breast Center. Welcome, Monet.
Well, thank you so much, Sheila. Thank you for having me. Hello, everyone.
Hello, thank you. Thank you for being a guest. Let me just share with you a little bit about Dr. Monet Bowling. She's a surgeon. She lives in Indianapolis, Indiana. She's part of the breast care team and she leads that team. She's a board certified surgeon and fellowship trained breast surgical oncologist. She completed her fellowship program at the University of Texas Southwestern Medical Center in Dallas, Texas, that is. She's been serving her community in Indianapolis for over 10 years. She is renowned in her field, a passionate crusader in the fight against breast cancer. She has earned a perfect 5-star rating from her patients on multiple provider review websites, including healthgrades.com, and was recognized in 2017, 2018, and 2019 as a top doctor from Indianapolis Monthly magazine. Another very special thing that you want to know about Dr. Monet Bowling is she is married to the handsome Donnie Bowling and the mother of 3 gorgeous, amazing, accomplished children. Welcome, Monet.
Well, how do I even follow that? Were you talking about me?
I really was talking about you, Monet, and I'm so excited to have you today. And anything you want to say, just to get started?
Oh, well, I'm just honored and privileged to be sitting here. And if many of you don't know, Sheila played a big part in me actually being here today. I have listened to her for a multitude of years, and she's been an excellent friend, confidant, and sister to my mother. And I guess you would say kind of in that vein, an aunt to me,
Yes.
and has watched my life and really been an integral part in me being honest and being myself and kind of being my truest form. And I would say thank you for letting me be here.
Wow, thank you so much. You make me cry. You make me cry. I'm so moved by who you are and who you've become. Thank you so much for that. Well, Monet, let's just jump right in. You know, the question I have for you is, what had you want to be a surgeon?
Oh, well, you know, what's really funny is I actually don't remember a point in my life that I didn't want to be a surgeon.
Wow.
There weren't actually times. I can remember sitting down with my mother as she's cutting up food. She would cut up, we lived in California, we'd cut up red snapper, we'd cut up fish, and I would cut the bones out of everything. So I thought it was fascinating that I would cut the bones out of everything and I'd trace them. So I'd trace the bones and look for the blood vessels and look to see if it would bleed and look
Wow.
to, even though I knew it wasn't alive, clearly, but I would still just use my knives all the time. And I was very good with knives. And so my mother, probably when I was about 4, said, I bet you're going to be a doctor. And I said, oh, okay. Do they get to cut things? And so my mom has kind of always known that I was going to be a surgeon. What drew me to breast surgery, being a doctor was kind of like, oh, this is who I am. This is what I'm going to do. I am the caregiver. So I love taking care of people. I'm passionate about it. I've always done that. I've always done that in my family. Anyone had a baby, I begged to be there. I wanted to be there for the deliveries. I wanted to catch. I wanted to see how it was done. But in terms of being a breast surgeon, just kind of watching and realizing I wanted to take care of people, but I wanted to get them through the journey. And so what's funny is that, people think of surgeons and they're like, oh, well, they just cut on you and then they're done. And that's it. And that was never what it was for me with breast surgery. My mentor was a great world-renowned breast surgeon here and in Dallas. My two mentors taught me that taking care of breast cancer patients is a privilege, and you get to watch people and be with them at the start of their journey. And if you're lucky, be with them throughout the journey. And for some, even at the end of their journey. And what a job it was to take care of them as they progress through all of that.
Wow. Thank you, Monet. That's amazing. It's funny. It's been a while since I saw you, but honestly, the last time I saw you, you were doing something and you were walking around with your hands like this. I was like, boy, she really is a surgeon. But I think that's fascinating. So it was right there at birth. And thank goodness your mom was present enough to kind of see that about you. You hit up on the first area that I want to speak to you about. You talk about, first of all, we're going to talk about breast cancer more, but all of it's connected. I want you to speak a little bit to us about your love for taking care of people and your philosophy of love.
So what it is for me is I have always felt like if people felt like they were cared for, if they felt taken care of, then they felt safe. And maybe it's my yearning for wanting people to feel safe around me, but really letting them appreciate that at any aspect in their care, not just cancer care, but their surgery. And I've seen little kids and I've seen younger kids and I've seen women who were pregnant and I've seen just all of these different people, and I've seen people at the extreme ends of life, and wanting to make sure that there was no fear in them being able to see a doctor and know that someone cared for them and listen to their stories, because it's in that listening to all of those stories that I feel like I am drawn in, and I want to know more about people, and I want to make them feel comfortable, because their comfort in the most vulnerable times of their lives is the point where they need you the most.
Wow, that's beautiful. And then Monet, talk to us a little bit about breast cancer itself, and especially with men as well, because I had a nephew who actually had breast cancer. So talk to us, those listening, and this is Breast Cancer Awareness Month. Talk to us about that.
So, when we're talking about breast cancer and breast disease for that matter, one of the things you hit on was male breast cancer. So male breast cancer actually is only 1% of the population. So if you can even imagine that of over the 260,000 people that get diagnosed with breast cancer, right?
Wow.
Only 1% of those men are men that develop breast cancer. But how odd or how life-altering that is for a man to develop breast cancer, because there's so much femininity attached to the breast. And in all actuality, what those men who develop breast cancer tell us about are possible genetic abnormalities, and kind of that link between you and your family and your DNA, so that breast cancer is, in some cases, about 10% of the cases, more than just the organ or more than just the tissue, but it's actually who you are as a person. It is your genetic makeup that causes some of these diseases. And I think that often gets skipped. Breast cancer as a whole, for 99% of the time happens in women. And so those women usually are kind of right after the prime of your life. So looking in the 50, 60, 70 type of age, but then often, and what we're seeing now we're seeing a lot of younger women who are developing breast cancer. And a lot of those cases are actually tied to the genetics of what is your DNA makeup? How are you made? How does your body get formed? Because you get that DNA from your mother and your father to create you. And that means that those genes combine, and any combination of those genes, any kind of mishap in those genes can create a cancer gene that can cause the development of breast cancer.
Wow.
And that is a rare kind of opportunity for people to have a genetic link to breast cancer. One of the other most common ways are really just that you're aging, your hormone levels change, and then you have changes that occur in the breast within the tissue, and you actually develop breast cancer in the ducts or the lobules of the breast, which is kind of the most common kinds of breast cancer that you have. Ductal breast cancer, or invasive ductal breast cancer, as we call it, forms from like the piping of the breast that kind of lead to the nipple. And then lobules are actually kind of like railroad cars. Like if you think about kind of the railroad tracks would be the ducts, and the railroad cars are the lobules that kind of house your milk. It kind of what makes your breast bigger or larger. Changes within those linings can lead to breast cancer. And that's usually 85% of the time the most common reason that people develop breast cancer.
Okay, great. That was really informative. And then, is there anything that we as women can do to prevent breast cancer or decrease the possibility of having breast cancer?
I love that you asked me this question. Absolutely. So when people come in, and I guess the one thing I wish I could tell people, I can't, but the one thing I wish I could tell people is that smoking causes breast cancer, because then I get more people to stop smoking, right? It does not. Smoking does not cause breast cancer, but there are many things that do. So I'm a breast surgeon, I'm an oncologist, and I am probably vehemently against hormone therapy. There are lots of women who get to be postmenopausal and they don't like hot flashes, and they don't like hair thinning, and they don't like kind of gaining a little bit of weight around their midsection, and they like their skin to look great, so they take a little bit of hormone. And although that is wonderful in normal circumstances, being on hormone therapy for more than 5 years actually exponentially increases your chances of developing breast cancer. And that's been studied again and again and again. So if you're going to do it, be on it for a short period of time. Another thing is losing weight. I know everybody's like, oh, here she goes. Another person who's going to tell me that I need to lose weight. But decreasing your body fat composition by small amounts can decrease your chances of getting breast cancer by 18%. What if somebody told you the betting odds of you winning the lottery were 18%? Would you do it? Of course you would. You'd try, not 1 in a million, but 18%. So exercising 3 times a day, 30 minutes each time, decreasing that body fat. And why is that important? Because each fat cell, each adipose cell carries those estrogen hormones on top of them. And so as you make estrogen and as you take estrogen, you can change those cells and actually create cancer cells. So decreasing that makes you so much healthier. Other things that can cause breast cancer are your genetic makeup. Clearly, if you have gene abnormalities, that can also cause it. Radiation that people used to get to their thyroid, or kind of radiation that happens centrally, can also affect the breast tissue. And a lot of people ask, do environmental things cause breast cancer? And if I can dispel any myth, birth control pills do not. Fertility pills do not cause breast cancer. So just being clear and very certain about that. Also, people who don't have childbirth, because there's no interruption in your estrogen cycles. Childbirth interrupts your estrogen cycles. So you kind of have these starts and stops of these high levels of estrogen. And you don't have those when you have never had a child. Breastfeeding is also thought to decrease your risk of having breast cancer. Yeah, absolutely.
Wow. Well, this is so awesome and informative. I mean, I'm just sitting here sucking it in, because today, as we speak, my sister is here in Atlanta, Georgia, at the doctor as we speak. She's going to receive her treatment for breast cancer here in Atlanta. She's from Indiana, because we can take care of her here. So this is kind of a twofold question. You know, one of the things I shared with you earlier I did today is I went shopping and bought her pajamas and a robe, and I just got into it because it really did hit me like, oh my God, you know, my oldest sister, she's like everything to me. And
you're her caregiver, right?
That's right. So when people get the news, and so I guess it's twofold. When people get the news, and then there's the, you know, recommendation for surgery or a mastectomy. I guess my question, I don't even know what to say. I got all choked up. How do we support how do we support our families? How do we support them?
So multiple things, unfortunately, sorry to hear about your sister, but knowing that she has her family to take care of her is fantastic, because many people kind of go on their journey without their siblings or without their family to help take care of them. So
Yes.
you had a natural reaction to want to care for your sister, right? Like
Yes.
this natural ability to want to love on her and to mother her. And so that, if I think about kind of one of the reasons why I went into breast care, it's because I wanted to be a caregiver to people who don't often have that opportunity to be able to help them, because I don't want anyone to feel like they're on this journey alone. And so creating a breast center, a place that they can feel safe and feel that love, is making sure that we can give that kind of care to people at their most vulnerable state.
Yes.
Most patients really get stopped and frozen oftentimes when they hear the word cancer. And so that is why I draw pictures, why I tell people, bring another set of ears, bring another set of eyes with you, because you're going to miss a lot of things that come after I tell you that you have cancer. And mind you, people already know that they have cancer by the time I meet them. It's just that the actual verbiage or the words land on them like something that you taught me many, many years ago, like word vomit. It's like, I can't believe you just actually said that. It just kind of slams them and they get stopped by that. So I find that people kind of fall into two categories. One category is they hear it and they're able to kind of just like take it in. Okay, I'm going to wear my pink, or I'm going to fight this and we're going to get through this. And then some people actually absolutely get paralyzed. And so for me, it's kind of taking care of the whole family, taking care of the family unit, because breast cancer doesn't just happen to the patient. It happens to everyone involved. And being a caregiver, often, depending on who the person is that developed the breast cancer, if it's kind of your family center, if it's your person who cares for everyone else, a lot of times families don't know how to take care of that person, or they've never had to, because that person takes care of everybody else.
That's right.
And so just trying to support the family as they realize that this is not a death sentence. It's a diagnosis, and there's going to be life after this diagnosis. And however long that life is, it's still life. And I think that that's really important, that if it's 2 days versus 20 years, it's the life that you've got. So you enjoy every moment. So how do I get patients and families and children and siblings to get with that person so that they can all get through it together?
It's great. Beautiful. Well said. Which brings us to two things, your symptoms. Two things I want to say also, because now I'm sitting here thinking, my mammogram got canceled due to COVID.
Yes.
Right in March.
Yes.
So, I mean, like tomorrow morning, I am getting on the phone, because then I kind of haven't done it. And,
so Sheila, you are not alone. If you look at every major medical center, women are right now probably about 3 to 4 months off of schedule for their mammogram. And that is because we had kind of hospital shutdown, right? Like everywhere, all over the country, hospital shut down. And the one thing that they shut down was the ability to get a screening mammogram. You could get a diagnostic mammogram if you felt something. So that's the difference. Screening mammograms, you're coming in, you don't feel anything, there's nothing there. Diagnostic mammograms are actually when you feel something or there's some kind of change. And so people didn't have to get them. And a lot of people were scared to come to the hospital. Well, hospitals are open. Don't let that year slip by. There's no need to wait another 12 months, because then you're 18 months off of schedule. Schedule your mammograms. They will get you worked in. We are here to serve people.
Thank you. That was great. I mean, I'm picking up my telephone tomorrow morning. I'm not kidding. And that brings us to, sometimes you feel something in your breast.
Correct.
But sometimes you don't have symptoms. So so what are some of are there other symptoms that could like alert us to, you may want to go have a mammogram?
So one of the things that I try to teach young girls, I try to teach college students, I try to make sure that everyone is aware, know your body, touch your body, know what your breasts feel like on your cycle, off your cycle, in the mid period or not. What do you feel like on a normal basis? Know what you look like. Get in front of the mirror and get familiar, because small changes. I would say about 90% of the time, patients can diagnose themselves. They know that something's not right. They feel something, they see something, it's a little bit off, they're not quite sure, their nipple has changed, it's higher, it's lower, their skin is thickened. All of those things are visible cues. But for those who don't feel anything and don't see anything, getting a mammogram can save a life. Mammography is the gold standard for finding small breast cancers. And we've gotten so good at being able to find cancers earlier with things like 3D mammograms, where you can find cancers almost 6 to 12 months earlier than we could before, even with digital mammograms, because we get small looks through the breast, and it's available everywhere. So people who have thicker breast tissue, larger breast tissue that's harder to see through, getting a 3D mammogram can find something earlier than later.
Wow, that's amazing. I mean, so this is really important. I mean, so pay attention to your breast, the size of your breast, if they change, or even just how you might feel.
How you may feel. If you feel a mass, clearly get it worked up. If you have changes to the contour of your breast, get it worked up. If you have discharge, one of the early signs of kind of non-invasive breast cancer, kind of stage 0 breast cancer, is that you can have bloody nipple discharge. And that bloody nipple discharge is your body like, hey, wake up. I've got something going on in here. Take me to the doctor and get me looked at. So all of those things become very important in making sure that we don't miss small things, because catching breast cancer early at an earlier stage, at stage 0 and even stage 1, 97% survival rate, up to 100 if we can catch it early enough.
That's beautiful. I was just about to ask you about the stages. And the stages, and sometimes I hear people say they have a very aggressive cancer.
Absolutely. So when we talk about stages, so most cancers are all staged off the same nomenclature, off the same naming way that we stage things, and it's called the T as in Tom, N as in lymph node, it's like node, M as in metastasis. So it's TNM staging system. And what we do for breast is very different of what we do for colon. It's very different for what we do for, thyroid cancer, but they're all staged off the same system. So for breast cancers, we look at the size of the tumor. Okay, that gives us 1 point. That's the T, that's the size. We look at if the lymph nodes are involved or not. So if you have 1 to 4 lymph nodes versus having lots of lymph nodes versus having matted or tight, like where everything's kind of socked in. And then if you have spread of disease, and that is how you get through that. And for breast cancer, we have 5 stages, stage 0, 1, 2, 3, and 4. And all of that has to do with size of tumor. And then kind of as you get into stage 2 and stage 3, whether or not your lymph nodes are involved or if your skin has any changes. And then stage 4 usually always deals with if the disease has spread other places in the body.
I see.
Now, aggression for breast cancer is slightly different, right? Okay. So aggressiveness for breast cancer kind of leads people to whether or not they need to have chemotherapy or not, or what type of surgery they need to have. And a lot of times that is dictated by what we call the receptors on the outside of the tumor cell. And it is the way that estrogen and progesterone and what we call HER2/neu are receptors that live on the outside of tumor cells. And if you have them, the estrogen or progesterone, you're a less aggressive tumor most of the time. If you have none of them, right? Everybody's like, oh, I don't have these receptors, I'm so happy. That actually makes a more aggressive type of breast cancer. It's like a double negative, except we call it triple negative in breast cancer. And so that kind of makes things more aggressive and means that we don't have a target, or we can't just give you a pill to fight against that. We need to give you chemotherapy.
Wow. Amazing. Boy, I can talk to you all day about this, but what I wanted to begin to say in this conversation, and we may have you back, it's Breast Cancer Awareness Month. What would you like to say to anyone listening regarding breast cancer this month? Yes.
I really, honestly, I've already said it once, and if I have a chance, I could probably try to scream it from the rooftops. Mammograms save lives. Do yourself a favor, do your family members a favor, go get a mammogram, because finding things early make a difference, and it can save a life. I mean, if you can find something at stage 0 versus finding something at stage 4, that is astronomically different.
Yes.
And your treatment is different. If I could say one other thing, is that really it's just a diagnosis. It's not a death sentence. It's not the end of your life. It's just the beginning of a new chapter that you figure out how to navigate, and we get through together. And that is the most important thing.
That's amazing. This was just so informative. I can't thank you enough. The question I want to leave you with is, and I do this every time on my podcast, is what do you love about your life now? And Monet, what do you love about where you are in life right now?
Oh my goodness, what a great question. What do I love about my life right now? Right now, and I guess COVID has made this very apparent, is I love my family and my network, because when things kind of get stripped away, so all of these things get stripped away from us, our ability to travel, our ability to kind of move independently, for us to kind of go where we wanted to go and do what we wanted to do, what are you left with? And it is those connections, those people that you formed your bubble with. And so in forming that bubble, like talking to my family, talking to my grandfather who's 94, almost 95, like
Wow.
talking to my mom, talking to my brothers, talking to my husband and kids, like sitting down. It's amazing how fun things can be when you've got to play board games, cook your own food, and have a conversation for once. There were no basketball games. There were no swim meets,
Yes.
track meets, dances. We all had to sit there and be with one another. And you get very clear about who you are when you can't run and you can't hide and you don't have that day to day. So if I were to say anything, it would be my family, because I love them. And they're very supportive, and I love them. If anyone knows us, like the Williams kind of bowling connection,
That's right.
We love each other. I tell my mom all the time, we're a gang. You know that, like we're a gang. We're down for each other. And so what do I love about where I am in my life? Just in a point, I've joined a book club since COVID.
Wow.
And I'm in an exploration to know more, not just about science or breast cancer, but to know more about being a human being. So when I kind of started off in college and I was graduating and everything was kind of up in the air, I decided that I was going to be the healer of human lives. Like, what did it take to heal a human life? And that's such a kind of like, really, like, who says that at 21, that you're going to be the healer of human lives, right?
Wow.
Like, it's huge, right? And so appreciating what it means to be human, and know that whatever the faults are, wherever we are, in that we're where we're supposed to be. You're right where you're supposed to be. So I'm kind of really looking at that and accepting that, and really happy with where I am, because I'm right where I'm supposed to be.
It's great. Beautiful. You're so beautiful inside and out. I'm serious. Honest to God, just gorgeous. Thank you so much. This was wonderful. For those of you listening, thank you for listening. Again, we had Dr. Monet Bowling, who is at the Hendricks Regional Health Breast Center in Indianapolis, Indiana. To everyone, thank you so much.
Thank
God
you.
bless you, and see you the next time. Bye-bye.
Bye-bye.